I'm Dr. Joe Niamptu, LoveThatFace.com, and thank you for watching, and I hope you subscribe to our channel. I love talking about cosmetic facial surgery, and one of the things that is one of my most favorite procedures are facial implants, and today we're going to talk about cheek implants. Now, I've done pretty extensive videos on this, and if you went on YouTube and Googled, or went on YouTube and searched for cheek implants, Niamptu, you'll see some of those videos. But we're going to do a little overview today. So cheek implants, or this area in the mid-face, are one of the most important and one of the most overlooked areas in cosmetic surgery. I've seen some really famous surgeons spend a lot of time doing upper face rejuvenation, doing brow lifts, eyelids, doing lower face rejuvenation, doing neck lifts and chins and facelifts, and they totally ignore the mid-face. You look at young people, you look at pretty people, they have volume in their mid-face. And as we age, we get hollow. And I'm going to show you a little PowerPoint presentation in a couple minutes here and go over all of this. So if you're going to go for rejuvenation, and if you're going to have eyelid surgery or facelift, you got to do something to the mid-face. 99% of people need something done to their mid-face, and I would say most people, by the time they're in their early 40s, are actually candidates. Now, what are your options? Well, there's a lot of options. You can do kind of mid-face lifts. Sooner or later, they're going to fall down. You can put fillers in there. It's become a real popular option, and I do a lot of that. It's going to dissolve. You can inject fat in there. I have a lot of friends that love fat. I got to be honest with you. I don't like injecting fat into soft tissues because it's here now. I don't know where it's going to be in 10 years, okay? Plus, you can't make it go away. I mean, it's very hard to make it go away. You can dissolve fillers. So, you have fillers, you have fat, you have lifting, and you have implants. Why are implants great? They're not great, they're perfect, because it's one of the few cosmetic surgery procedures that's both permanent and reversible. So what does that mean? Well, it takes about 20 minutes to put in cheek implants. It goes through a little incision inside the mouth, so you can't see the scar, and a little screw holds them in place. I am emphatic about securing all my implants. I'm going to tell you, I see people that have implants that are moved all over the place, and other surgeons can say what they want. I secure all my implants with a small titanium screw, or sometimes several screws. And the great thing about it, and full disclosure, I have cheek implants, okay? And I've had them for about 8 years. And so I don't need to do filler. I have volume right here. And if I didn't like them, it takes 10 or 15 minutes to remove the implant. So they're permanent, but they're reversible. So, with the advent of fillers becoming so popular, a lot of people get fillers in their cheeks, and that's great. But after a while, it's expensive. And cheek implants are really affordable when you factor out that you're going to have them, all your life, unless you want them out. So some other things. People say, well, what will I look like with cheek implants? If you lay down on the floor, and I'll show you this, or lay down in a chair, put your chin up and hold a mirror over your head, the gravity fills that area. And that's a pretty accurate thing of what you might look like with cheek implants. So when we do them, you can do them under local anesthesia, but honestly, I don't hardly do anything under local anesthesia. Everything is either sedation or general anesthesia, and you can do these very easily with sedation. And we still numb the patient. We make a little incision inside the mouth. We do a little undermining of the tissue, slip an implant in there, and I'll show you this when we go to our next segment of this talk. Now, again, there's so much to talk about. It's not in the confines of this single video. But there's a lot of sizes and shapes. The submalar implant is the most versatile, and that's probably 90% or more of what I put in, because you can change the size, you can change the shape, and quite frankly, I've done so many of these for decades that I customize a lot of them in the first place to specifically fit the patient for that application. So if you love them, they're there. If you don't like them, or you want a bigger one or a smaller one, they're easier to change. And it's just really an excellent option. They're made out of silicone, which has been used in the body for over a half century. It's very biocompatible and very safe. And again, when they're secured, they're not moving. They're not causing foreign body reactions where you have bone loss in situations like that. So I've had great experiences with them, and I'm going to go into another little presentation and touch on some more things. So stay with us, and we're going to talk about cheek implants. I'm Dr. Joe Nyamtu, LoveThatFace.com. So let's get on with it. And today we're going to talk about cheeks, mid-face volume, and beauty. And if you look at beautiful men and women, young or old, people that have full rounded cheeks are considered youthful, younger looking, more alert, more awake, and it's a very important thing. Again, males are the same way. When you look at males with volumized cheeks, they are considered handsome, or in some means even striking. So the mid-face is extremely important, as I said earlier. When we are born, we start out as a grape and we end up as a raisin. All right, and this is from birthdays, heredity, and the bad habits that we do, like smoking, drinking, and sun. So when we talk about the loss of mid-face volume, this is a mechanism of deflation from the raisin to the grape. So as we age, we deflate. So this is a little bit of my family tree. We have my son, myself, and my father, who's 27 years older than I am. And when we took these pictures, you could see that my son has youthful fat in the right places and non-damaged skin, but he has that full mid-face that children and young people have. You can see in the middle that at that point in time, that was before my cheek implants, I was really starting to lose my mid-face volume. And if you look at my father's picture, and he's now 94, he has lost virtually all his mid-face volume. So a flat or skeletal mid-face definitely makes us look older. When we discuss the volumized mid-face on youthful people, we're basically talking about the malar fat pad, which sits up on the cheek. And in young people with nice, round, firm cheeks, this is what supplies that support. And I break this down into three areas when I'm considering cheek implants, or even when I inject fillers. And number one is the infraorbital area, number two is the malar area, and number three is the zygomatic area. So I customize my procedures based on what the patient needs in these various areas. To discuss the distribution of facial fat and what happens as we age, if you look at the patient on the left, this is before I did her facelift, and she has flat cheeks, and the volume that was in her mid-face when she was young is in part descended down to her jawline, and it becomes her jowls. So patients that are in their late 40s, early 50s, they start to get this face that is actually a square face. And it's square on the jawline because of the excess skin and the fat loss. And if you look at her after her facelift, you can see that I've replaced the volume in her mid-face by placing cheek implants, and I've tightened her loose tissues of her jawline and her neck, and she has a youthful, oval, volumized face. And that's very important. If you can appreciate the changes in this picture, then you understand what's going on. And again, the elderly face is like a egg, and the youthful face is more heart-shaped, or like an upside-down egg. And I like Burt Reynolds, so I'm not picking on him, but the point I'm making here is that sometimes cosmetic surgeons will make patients look tighter but not younger. And this happens because as we age, we lose our volume, we have this skeletonized face, and if you pull the skin tight over a skeletonized face, you make people tighter, but you don't make them younger. And surgeons that understand this are the ones that have great results. So you have to put something back. In my case, I love putting cheek implants back. Other surgeons, again, they may do fat injections, they may do filler, they may do mid-face lifting, but I've already explained why I'm such a fan of cheek implants. So again, when I discuss middle facial third, the face is divided into equal thirds in your average youthful or attractive male or female. So the upper third is kind of the forehead area, the lower third is the lower lids and cheeks. I'm sorry, the middle third is the lower lids and cheeks, and the lower third is from the nose down. And too often it is this center third, the middle third of the face, that surgeons ignore. So I'll see some very famous surgeons in California who do celebrities, and they do a brow lift and upper lids, they do lower lids, they do facelift, they do laser on a patient, but they don't do anything to the cheeks. And you can spot those patients a mile away because they've been made tighter but not necessarily younger. Now the same thing goes in reverse. Although a unvolumized cheek makes somebody look older, if you overcorrect the cheek, that looks hideous too. And as far as I can tell, this is a trending procedure in Hollywood because I see so many celebrities that just have ridiculous overdone cheeks, and it just doesn't look good. So there is certainly, like anything else, an art to restoring volume in this area. As I said earlier, you can move the facial skeleton to enhance the midface. You can do midface lifting procedures. You can inject fillers. And of course, you can do cheek implants. So there's a lot of ways, and whatever works in the hands of the surgeon, as long as he has no complications and good results, safe surgery and happy patients, then it's fine. The reason that I like facial implants is, like I said, I'm not really a fan of fat in the midface. It's really not readily reversible. It can change and it can droop. Fillers are going to dissolve. Lifting procedures are going to fall, whereas implants are a 20-minute procedure and a permanent solution, as I've said several times. So another reason, or reasons that I think it's such a perfect procedure, there's no visible scar, so the incisions are inside the mouth. Again, in experienced hands, it only takes about 20 minutes to do this. You get an immediate, you don't have to overcorrect, you get an immediate 3D volume restoration, and these come in so many different sizes and diverse configurations that you can really customize the patient's midface the way you want to do it. It's permanent because they are retained with screws, but it's reversible and can be changed, reversed, or removed at any time. And to me, this combination is hard to beat. So, you notice that I spend a lot of time standardizing my pictures, and standardized photography is very important. And I'm not passing this off as standardized photography, but this is a real important series of pictures because this is what the patient sees. Okay, so if you look at the picture on the left, the patient was younger. She had a volumized midface, nice soft round curves, and that's what makes us look youthful. And then 5 years later, in the center picture, the patient starts looking drawn. Her midface volume is deflated, and she has now fullness in the jowls at the jawline, and she has this flat midface and some under eye bags, and it just makes us look older and tired. And if you look at the picture after we did her eyelids and I placed cheek implants, and obviously this is a glamour shot and she's smiling, but this is what she sees in her mirror. And even though this is not standardized clinical photography, it illustrates what the power of mid-face inflation with silicone cheek implants can do. So there are many, many sizes and shapes and styles. These happen to be Implant Tech silicone implants. And for new surgeons, it can be a little bit confusing. However, I use the submalar implant for most of my procedures. So different patients need different types of augmentation. That's pretty obvious. So the patient on the left really needs submalar fill. The patient in the center needs zygomatic and malar fill. And the patient on the right needs fill everywhere. He has virtually no mid-face. The three common types of implants that I use would be the submalar on the left, and that's probably 98% of the implants that I use. They come in a lot of different sizes, and I frequently customize them. The malar shell implant is for patients that want more of a high cheekbone look, and that's a bit dated. kind of that twiggy look from the 60s and 70s, although there are still applications for it. And the picture on the right shows the combined submalar shell, which is a combination of the first two implants, and that really kind of covers the entire midface. And again, don't use it that often, but I use all of these when I need to. So if you look at this patient that I did, I performed eyelid surgery, I performed a small facelift, and I performed submalar cheek implants. If you look at the before and you look at the after, what makes that after picture so nice? It's really the cheeks that has really inflated this patient. She almost looked tired and angry in the preoperative picture, and you put these cheeks in and it just smooths her out and rounds her out and gives her back that nice, youthful, round mid-face volume. By the way, I've had this picture ripped off probably 50 times. I've seen this on other people's websites, and they call it fat injection, or they call it Kybella, or they call it thread lifts. It's so funny. I'm not sure what it is about this picture that makes people want to steal it from me, but I frequently see it out there. And my lawyer writes them a letter because I only have permission for this, not other people. So again, back to the submalar implant. This is about where it sits on the face and on the skeleton, and this is really the area where most people lose volume. If you want to show a patient, or you want to see for yourself what you might look like with cheek implants, the easy thing to do is to lie down, put your chin up, and look in the mirror. And what this does, this causes, in patients with facial aging, this causes the loose tissues and the floppy tissues to kind of reset, because you're taking gravity out of the situation. And it's a good way to show people what they look like with cheek implants, or also with a brow lift or a facelift. It kind of resets the face. So this is something that I do when I am consulting patients for cheek implants. So let's talk about how we do this and who's a candidate. So obviously, if you're going to have implants that go through the mouth, you have to have a healthy oral situation, and you need to have an X-ray or CT to make sure that there's no sinus problems, no cysts, no infections, or anything else that could affect the implant. And it's also nice for us to know, in some cases, where the nerves are. So we always get some type of imaging. So when we do the implant, this can be done under local anesthesia, but I'm not a fan of doing that. Virtually all of my patients are sedated, and I think that it's easier for them and I can do a better job. And we make about a centimeter incision inside the mouth above the gum tissue. And this is what the incisions would look like before we place the implant. And these implants have try-incisors. And so what these are, these allow you to size the potential implant to see if it looks good in that patient. Small, medium, large, extra large. And also let you try in different styles of implants. So just like you may go into a shoe store and try on different sets of shoes, we have these sterile try-incisors that we can use to see what the patient would look like. Now, I've done so many of these over the last couple decades, I pretty much know what I'm going to use, but I think it's always important to try in different ones just to make sure you find the most natural look for the patient. So after we do our dissection and free the soft tissues from the bone, we have a little space in there that the implant sits, and we can take the implant and put it in that space. You want to make sure that the implant is not folded over. One of the things in my practice, I tend to see a lot of patients that have had implants gone bad at other offices, and I've seen people from all over the country and really all over the world where they've had implants that have shifted, or the wrong implant was placed, or they were touching a nerve. So one of the parts of my practice is repairing things that just didn't go well in somebody else's hands. So just a little overview. There's our incision in the upper left. This is very stretchy tissue, so that's what the bone looks like after you dissect the tissues. You can see on the lower left placing the implant, and then that's what the implant looks like when it's in place. One of the truly powerful things about silicone implants is how easy they are to customize. Because they're made of a soft material, they're very easy to contour with scissors or a scalpel, and your really experienced surgeons will frequently contour these to make a custom fit for their patients. Now, you can actually make custom implants off of a CT scan that are made specifically for that patient. But in all honesty, unless there is some type of big asymmetry or previous trauma or cancer surgery or birth defect type of deformity, generally there's no reason for custom implants because we have the ability to customize these off-the-shelf implants. Now, this is something that is really important in my mind, and that is screw fixation. I want you to look in the lower right-hand corner, and you can see how tiny these titanium micro screws are. And I use screw fixation in any facial implant that I place, and I think it is really important. I think that's why I have virtually a zero rate of implant migration and a very, very, very low rate of bone resorption, infection, or other implant-related complications. These screws are tiny. You could probably put 20 of them on a dime. They're titanium, so they don't set off metal detectors, and they don't affect MRI scans, and there's no reason not to use them. Many surgeons think they're unnecessary, and that's fine. You should do what works best for you. But I can tell you one of the most common things that I fix on other people's implants are migration, where the implants were placed and at first they were in a good position, but there's a lot of muscles in the face, and when the patient laughs and smiles and eats and everything else, it ends up displacing the implant and they move. I can promise you, if you put screws in this implant, it's not going to go anywhere. And I've been doing that for over 3 decades, and I stand by that. So this is a picture intraoperatively, and you can see there's an implant on each cheekbone retained by a single screw. And I also, as I said, I have cheek implants, so my implants have a screw, and I never ever feel them, and I can tell you firsthand that they just are not a problem. So after we place the implant, again, experienced surgeons know what to look for to make sure things are symmetric and even. We'll rinse the area out with antibiotic solution, and we close the incisions with resorbable stitches. I see so many patients from out of town and a lot from out of the country that we always use dissolvable stitches. In the picture on the right, if you look, that's what the scars look like after 1 week. The inside of the mouth heals extremely fast. So let's discuss cheek implant recovery. Like any other procedure, it's variable. Some patients do quite well and have minimal swelling, and other people get pretty swollen, maybe similar to having their wisdom teeth out. Bruising is rare. And again, this procedure, I've said numerous times, it takes 20 minutes. And, that's the actual surgery time for an experienced surgeon. In reality, by the time you sedate somebody, do the surgery, and then wake them up, it's probably about an hour. So looking at this slide, the picture on the left is a gentleman that's 4 days after implants. The gentleman in the center is 3 days after cheek implants, and the young lady on the right is 1 week after implants. So they actually heal relatively rapidly. It's not really a painful recovery. You are numb for a while just because the surgery is in the area of the sensory nerves. I've never had a permanent numbness from this, and some people may be numb for a couple days, a couple weeks, or even a couple months. But the high side of that is rare. Another thing with cheek implants is that since you're cutting some of the muscles temporarily, your pucker and your smile may be a little off, generally for a week or so, and all of that grows back and should totally return to normal. So now I want to go through some before and after pictures of facial implants, and this is a great picture because this shows the power of of facial filling. This patient has some type of fat atrophy and is very skeletonized, and we did a lot of procedures on various parts of her face, but the biggest thing that helped this patient are these beautiful cheek implants that volumized her face and made her look decades younger by inflating her deflated midface. Here's a patient after placement of cheek implants and silicone chin implant. And again, she had a very hypoplastic midface that was deflated, and we have softened her by giving her cheeks and normalized her profile with the chin implant, which I also do a lot of. Again, you just look at somebody, and this is a cheek and a chin implant. We do these combinations frequently, and you can see the patient has nice, round, youthful cheeks and a more normalized chin profile in the after picture. Sometimes patients tend to look tired and angry when they lose their volume, and I think this is a good example. This is a very sweet patient, but she just, kind of looked tired and angry because of her aging. And I did a facelift and cheek implants, and it just, putting those implants in just fills up that midface and softens everything. And obviously the facelift helps her jawline and her neck, and it totally changes these people. And one of the great things about what I do for a living is I can change their life. They just feel so much better about themselves. Here's another pretty dramatic case of an older patient who I did upper lids, lower lids, cheek implants, chin implant, facelift, and a full face laser resurfacing. And I stand corrected, I did not do a chin on this patient, but I did cheeks. And again, look at the cheeks before and after the surgery. It just makes such a big difference having that round, youthful, volumized midface. Another patient, cheek implants and a chin implant. This patient has what is known as a witch's chin, where you just have this floppy chin, and this happens sometimes in aging females. And by putting a chin implant in there, it supports that. But I want you to look at her cheeks. So we did eyelids, facelift, cheek and chin implants, and we're talking about cheeks right now, so look at her cheeks. Another dramatic case, this is a brow lift, upper lids, lower lids, cheek implants, chin implant, facelift, full face laser. Obviously, a big combination, but a big result. And if you look at what the cheeks and what the chin did for this patient, it's huge. Here's a young male, and even at his age, and I think he was still in his 20s, he just did not have sufficient midface volume. And this is a malar shell implant, the combined malar shell. And it really softened him and made a big difference, and helped him in his modeling career. And I've seen this patient now. These have probably been in for about 15 years, and they're doing great, and he's still looking good. Here's a male patient. Again, if you look at the before picture, just baggy and saggy and tired looking. And by doing eyelids, putting cheek implants in there, and doing a facelift, we just make the patient look more youthful, more volumized. So look at those cheeks in the before and after, and that pretty much says it all. Another patient that, is an attractive lady, even with her mild aging, doing a facelift and some laser and putting in these cheek implants. Again, this is one of those pictures that if you just look at her cheeks and you can see the difference, then you pretty much understand what cheek implants will do. Another patient just putting in cheek implants. That little bit makes a huge difference. Makes people look happier and makes them look more youthful. Same thing here. And again, as we age and we lose this midface volume and get this jowling and extra skin, we just look sad and tired. And I did eyelids, facelift, and cheek implants on this patient, and it makes all the difference in the world. Look at her cheeks before, look at her cheeks after. Here's a patient, eyelid surgery, cheek implants, facelift, and again, it just takes decades of aging away when you volumize the cheeks. So I know I'm beating this into the ground, but volumizing that mid-face is so important in a youthful, natural result. So, there's two things that I have to do to be successful. One is to do safe surgery, and we have an accredited surgery center. I have an incredible, compassionate staff, and I am passionate about cosmetic surgery. The other thing that I have to do is to have natural outcomes, and I think that some of these examples show you. I love what I do. I could sit here and show you nice before and after pictures for hours, but I hope that this has enlightened you on what we do and what cheek implants do and why they are so versatile. This presentation was made mostly for patients. However, if there are doctors watching, I have a training course, a live surgery observation course every September in my office. I have a for-purchase online video series that I'll tell you about in a minute. And if you are a doctor or a nurse practitioner or anybody that does cosmetic procedures, I have a video series that you can download and own on all facial procedures. I'm also pleased that the second edition of my textbook remains in the Amazon top 5 in medical textbooks, and my facelift textbook will be coming out this October. So I truly am a fortunate guy that I get to do what I love and love what I do, and I really appreciate your time. So from Richmond, Virginia, this is Dr. Joe Nyamtu, LoveThatFace.com. Stick around and I'll tell you a little bit about our video series. Hi, I'm Dr. Joe Nyamtu, CosmeticSurgeryEducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high-definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to CosmeticSurgeryEducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7 as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, CosmeticSurgeryEducation.com. I'm Dr. Joe Nyamtu.